Now you're very active in martial arts. You teach it as well. Tell me a little bit about how you felt before the procedure. Like what things bothered you, things like that.
Yeah, actually, yes. Before the procedure, I had it done in March. For I think just over a year, I was constantly, almost maybe just about every day, I was in pain.
Okay.
So I started to become slow in my movements and I practice martial arts. I greatly slowed down quite a bit in doing that. And even though I was instructing, I still was moving around and holding the bags and still have to teach. So I still have to perform and show the students how to do the self-defense.
Yeah.
So on the left shoulder, the left shoulder and the left knee especially the left knee was more critical, or I was more in pain. I was mostly, even standing, I was putting all my weight on my right leg, so I could stand and hold it there. But I tried to walk. That's about the most exercise I was doing to help it to keep moving. But after the procedure, within, I would say 3 months, the left shoulder greatly improved. Now it's October, and I guess as far as the shoulder goes, it's about 95%.
Okay.
I would feel that no pain. I even forgot about the shoulder.
Yeah, and now we just talked about too is now you're able to start hitting the bag some, holding the pads for some of your students and things like that. Is that correct?
That is correct.
Okay, so about 95%. That's really good. So 7 months. So is this a procedure, if somebody had a problem with a shoulder or something like that you would recommend them, at least consulting to see if they're a candidate for?
Yes, I wish I had done it sooner. I didn't know about this. I was kind of doubtful about. I've heard about it maybe a few years ago, so I was skeptical. So I let it go on for years and years, but I finally said, you know what? Looks like surgery. They're telling me that surgery is the only option, and I hate it. That's my last resort, to go to surgery. So I gave it a try. I said, and sure, I was kind of surprised that the shoulder really improved. So I'm glad I did it.
Yeah.
I wish I'd done, like I said, wish I'd done it sooner.
Yeah.
The knee is taking a little bit longer. It does feel better, but I understand that my left knee is quite a bit was a bit more degenerated than my left shoulder. So, which is why I really recommend that if you start feeling pain, don't wait.
Yeah.
The sooner you get it diagnosed, the sooner I would say it'll get fixed.
Yeah. Great. Okay. Well, so it sounds like you're pretty happy then.
Yes, I am.
Okay, good. All right. Well, thank you so much for sharing with our patients out there.
Yeah.